Hello, I'm Dawn Durham, and welcome to PaTTANpod. When we think about our speech and language pathologists in our school buildings, we oftentimes think of them in isolation. We want to change that mindset. Our SLPs offer more than articulation. In understanding this, we don't always know what to talk about or what to ask our SLPs to help us navigate with a student. Here to help all of us understand not only the larger role our speech and language pathologists play, but more importantly, how can we team with our SLPs to make instruction more effective and efficient? Elizabeth Christopher, Pennsylvania State Lead for Speech and Language. Thanks, Elizabeth, for being here with us today. I appreciate it.
Thank you, Dawn, for having us on Better Speech and Hearing Month. I appreciate it.
So let's start kind of basic. Can you define the role of a speech and language pathologist within a school setting?
Okay. It's really important to define it as within a school setting because speech-language pathologists have extensive training in the evaluation, the diagnosis, and the intervention with speech-language difficulties. We are trained from birth to earth, so we are trained across all settings, medical, outpatient, clinical, and school-based therapy. We have a wide range of knowledge on acquired and developmental language impairments. We are trained also in both normal and abnormal language development, and that can include speech, and that can include language skills as well. In our training, we learn a lot about speech sound disorders, language acquisition and development, social pragmatics, voice, fluency, and cognitive deficits as they affect or pertain to communication, so executive functioning, attention, and memory. So we have a lot of training and a lot of insight to offer to our school systems as we go through it. We frequently work across the settings, as I stated, so that gives us kind of a wide range view of what children come with and leave with and where they need to go after school and preschool. One of the things with SLPs, as you stated, in the school systems is we're responsible for making sure that all of our services and speech language are within the setting of free, appropriate public education and least restrictive environment. So that's how we differ a little bit in the schools than our outside provider friends or those of us who have worked in other clinics, because we really set and caveat everything in the academics and our child's educational impact and experience.
So just hearing you go through all these, I mean, there's such a wide range of expertise that a speech and language pathologist comes to us and comes into our school setting knowing that birth to earth, just the language development and the speech development from when a child is born all the way up through adulthood in itself is a key piece. You had talked about evaluation, diagnosing, and intervention. I can think back to my classroom days, and I'm going to be very honest with you, and I think some of your SLP friends listening would agree. There's perhaps a thought that an SLP is there as an extra set of hands or a bit of a glorified assistant in the classroom. My thought is, in hearing you have a pretty in-depth training and technical expertise, there's more to it than that. So talk to us about what can an SLP add to an instructional diet for a student beyond the articulation, which I think is so commonly referred to.
Yeah, as you said, we are so much more than articulation. While that's a really important subset and something that generally we are the only ones doing, it is important to see past that. So as we look, academics are a key, language is a key piece in academic growth. And there are so many sub-skills to language that impact academics in the classroom. And when we look at partnerships between a classroom teacher and an SLP, it's really important to look at our relationship as a partnership, as a co-training or co-teaching experience versus now he's mine. I take him to my room, I do the therapy, and then I give him back. What we know about academics is we need to be reinforcing these language skills as we go through, as we go through all our days. So language skills are really important for describing, for comparing and contrasting, for sequencing, and for retell in our academics. This happens in your classroom all day long. So working with your SLP to ask the questions regarding what you need to do to impact your student will really help along the way.
So when we think about that, what can an SLP do for me? Yes, they certainly can take a child from the classroom and pull out therapy session and do some real intensive work on whatever the skill deficit is that child needs, whether it be articulation, language, social pragmatics, whatever it is. But more importantly is and help me out here, what I hear you saying is more importantly is they are the push and expertise, the partnership, the collaborative piece that we may be missing in our classroom to make our instruction as effective and impactful as it possibly can be.
Absolutely. And at times it's really hard to coordinate that push-in or that pull, even the pull-out therapy is incredibly hard to coordinate. And so being true partners and discussing open and honest discussions with each other regarding what can I do? What can I do to impact this child in my classroom? As we know, there's 14.5% of the speech and the special ed population in Pennsylvania are labeled as a primary disability of speech and language.
Okay, I didn't know that. 14.5%.
14.5%. Okay. So when we look at early ages, 6 to 11 age, 50% of your special education will be speech and language.
Wow.
Of those kids, they are they're all served in the classroom. Over 90% of their instructional day is in the classroom. And again, if I go back to what academics is language, that describing, that sequencing, all the things that we are teaching in our classrooms as we go through, that child will need extra support in that growth. They'll need coordinated plans amongst the SLP and the teacher in order to make that work.
Gosh, when you put it in numbers like that, it makes so much sense to have the collaborative relationship with an SLP in the classroom. And you're right, 90% of a child's day is spent in the classroom setting. And who's the person in the classroom? The classroom teacher. And that classroom teacher, as wonderful as they are, it does not have an area of expertise in everything that they need an expertise in. It's just not possible. That's why we partner with other folks. And so to hear you say that makes complete sense and kind of leads me into my next line of questioning I want to ask you here. When we think about the time of year it is, we're kind of wrapping up this school year. A lot of schools are getting together to have meetings about placement for students in the following year, classroom decisions, building decisions potentially of where folks are going for shifting to an elementary school from a kindergarten or a middle school or what have you. And we think about what this process will look like over the summer into the start of the school year when folks are meeting their students for the first time. Talk to me big picture wise. What are some questions? If I'm a classroom teacher and I have a student on my list that has a speech and language IEP, which we know, roughly 14.5% of kiddos who have an IEP have a speech and language IEP. What kind of questions? Again, big picture. I know we can't get into every ounce of it. Big picture. What kind of questions should I be asking, or how should I be inquiring information to help impact the education of this student, knowing that I've got to work with my SLP? Help me out there.
And I have to say I absolutely love that question because as an SLP we frequently feel like it all falls on us. So it's really helpful to have these conversations. The biggest picture is to ask your SLP, how will these deficits or needs impact academics?
Okay.
So the big picture idea. In order to do this, you might need to provide more information about your classroom to the SLP.
Okay.
We are across the setting. So an SLP can be in a kindergarten classroom at 9 a.m. and a 12th grade classroom at noon. So it's really difficult for us to know every aspect of education. Just like you said, it's hard for a classroom teacher to know. It's incredibly difficult for us to know how your classroom is different than the classroom down the hall. So things to, when you ask about how the deficits will impact academics, be specific of your goals in the classroom. Be specific of how you teach, what you're teaching, and perhaps why you're teaching it. That will help. SLPs who specialize in the school systems know a lot about curriculum, but we don't know everything. And sometimes we need some guidance on how are you teaching reading? Are you using sound walls in your classroom? If I hear that, I know what to tell you next.
Okay.
Other pieces is to ask your SLP for information on the SDIs. So every IEP has specifically designed instruction. That is the responsibility of the entire IEP team, which includes your classroom teacher. And I think frequently as SLPs, when we're working solo, we take full responsibility. That's sometimes our own thing. You know, we're all a little type A. So in coordinating what are the SDIs, how can you use those specifically designed instruction in your classroom? We also understand that teachers don't only have that one child. If you're a teacher in the early grades, you have multiple kids who are probably going for speech. Asking how you can coordinate all those SDIs and all those strategies and prompting methods may help your life be a little easier and help us to guide you along the way. Because we know the more you can carry it over in the classroom, the better for the child. Perhaps the faster the child will remediate the deficits. And our ultimate goal in speech pathology is to work ourselves out of a job. We want the child back with you as much as possible. So those questions will help kind of figure out the way. If at any point you have questions, I loved when my teacher said to me, can you model this?
Okay.
Can you come in and show me how to do this? Now, I completely understand from my SLP colleagues in the field, we have 65 kids a lot of times on our caseload across districts, driving around. It's hard sometimes to get in there. But the more that we partner in that way and model how we're doing prompting, how we're doing strategies, what it looks like, smells like, feels like, that sometimes is better for carryover.
So one of the things, and you kind of just led right into it, when you're talking about looking at the specifically designed instruction, the SDIs, and thinking about the fact that you're likely to have more than one in there, the way we can coordinate so that the prompting, the techniques, the strategies that are being used in a therapy session in isolation when they're outside the classroom can be carried over into for all the benefit of all the students. Because I would imagine, and help me out here, I would imagine that if you're in a classroom and I've got maybe 2 or 3 kiddos who do not have speech IEPs, but I notice a couple of things here and there, it matches perhaps some of the kiddos that do have a speech IEP. If I am really coordinating with my SLP and really working on how to integrate that instruction throughout for all my students throughout my classroom, we all benefit, not just the 3 kiddos who have the piece of paper that says they need this speech and language accommodation or whatever it may be.
Absolutely. What we know about language development, speech and language development, is that it's a continuum. And kids come in with different Swiss cheese holes. And those kids can very much be typically developing kids who did not have the same experiences or background knowledge as their peers. And frequently the interventions that we do for the kids who qualify or are eligible for speech and language services in the school would benefit those other students. And a lot of times our classroom teachers struggle or are frustrated with us, I should say, because we don't pick up every student that may have a difference. We are really rooted in having to pick up the kids and work with students with the true disabilities. So we know that those children on the continuum on the lower end of development would benefit from those strategies as well. And sometimes we have some classroom teachers in the state of Pennsylvania who are just honorable SLPs. They're amazing in what they're doing as they've picked up these skills and learned how to grow language. Because language and communication is something we can grow, and it's something we can also decrease in our students based on the environment that we set up for them.
I love that grow language. I love that the way it feels. I love the implications for not just the students in my classroom that have a speech and language IEP, but for all my students, because we're all learning in language. Even through adulthood, we're all growing in language. So I really appreciate that term, and I think I might start using that when I think about classroom teachers and coordinating with everyone, not just speech and language, but all the outside services and outside providers that they have. We're looking for growth. Not just academically, but in language, in conversations, on the social aspect, on behavior. We're looking for growth everywhere. So I think that's a great piece. So thank you so much for that. Let me ask you, kind of for everyone out there in the field, we try to really inspire folks to take a look at where they are at professionally and grow. What can I learn and how can I grow? What would be some advice you have for those in the field to grow professionally?
Okay, I'm going to approach this by 2 ways.
Okay.
First, for my SLP friends, who, as I mentioned, we are trained in a wide swath of communication, and sometimes as we're learning school-based issues or working in the schools, we need a little more information regarding what our classroom teachers are doing on a daily basis. And I completely understand, having been a school district SLP, the massive size of our caseloads and the workload and sometimes the mental load that having 65 students kind of sits on you. Just as a classroom teacher has that mental load, we wake up in the middle of the night thinking about, did I do enough? Sure. Am I getting there?
Yeah.
So that being said, and we have to keep up on speech and language interventions that are appropriate, we really need to strive to keep up on education interventions that are really helpful. So one of the pieces of the puzzle in my work that I've seen that would really benefit SLPs is knowing more about literacy and what our teachers know and don't know about language development's relation to literacy. Sometimes it's interesting to sit in a conversation and think, oh wow, I knew that after all. This is how I can explain it. Using the language of the classroom. We have a lot of jargon, and so do you.
Yeah, very much so.
Getting to know, what does phonemic awareness mean to you, and how's it different to what it means to me? And so some resources that I'm just going to shameless plug are our PaTTANpod here, but our PaTTANpod on sound walls would be incredibly important for a speech pathologist to know. We absolutely know all those placements, everything about that, but how is it used in the classroom may be new to some therapists in the early grades. Other information is attending behavioral trainings, learning about PBIS, and what's your role. How can we interact in MTSS and with English language learners? Because we know very much as SLPs that frequently we get referrals for English language learners that are not appropriate. So if we can speak the language to help teachers like yourselves to know when to refer, when not to refer, what is the difference with a disability. And then if I take the other side of the coin for our teachers, come to a speech and language training. They're open to everybody. They may have some jargon that you don't understand, but ask your SLP. Talk to your SLP as much as you can. Sometimes we feel like we're pushed in a closet or we're over there because we're busy, and so are you. But figuring out how to partner together. So if you have a student with apraxia of speech in your classroom, for example, or deficits in language development, come to one of our trainings with your SLP. Partner with them to talk about how would this look. I know it's so hard to get out for 5 hours for that, but come to our sites and look. The other piece of development for a classroom teacher is learning what development looks like for kids, especially early grades. A lot of my work in the dyslexia pilot sites was discussing what is normal language development and what concepts should we be pulling into our oral language interventions across for all kids, not just children with disabilities. And what we learned from that work was sometimes classroom teachers' expectations of development were a little off of what ours are. So I highly recommend to teachers that you learn the developmental norms for a class 2 years below yours. And a year or two above yours, so that you know that breadth and that that development that you're looking at. So you feel better about, okay, I can get this child to move and grow their communication, especially if the SLP has done the evaluation and determined, okay, this is a difference. This is a lower language student. That will really help in that growth pattern. And ask your SLP for resources. We're always looking at the best blogs or the best groups to join. Ask them where to get this information. They'll be happy to help.
So I hear, if I can kind of sum that up into a theme, it'd be partnership. Don't be afraid to partner on the other side of the aisle there. Don't be afraid to say, well, I don't really know much about this. I'm going to go to an SLP training. As across the state, they're open to everyone.
They are.
And on an SLP end is don't hesitate to come to an MTSS training, a literacy, a math, whatever it may be, to kind of understand where everyone's at in their knowledge base. Because I think, as we've said, we don't know what we don't know, and I don't know what you know, and you don't know what I don't know. So we need that partnership. So I think that theme of partnering and collaborating beyond our grade level peers and with our SLPs is a key piece here that we need to start thinking about for the better outcomes of our students.
Absolutely. We are not trained together. So many of our counterparts are trained in the College of Education together. And so we kind of have those natural trainings. Most SLPs are not trained with their education counterparts. So we don't, it takes some time to learn how to partner together. Much like when I worked in the hospital system, it took me some time to learn that lingo. It's really important for us to learn your lingo, and that way we can help meet you where you are and not talk down, because sometimes I'm always surprised what is known, but not talk over as well.
So be friends and partners.
Absolutely.
Partner, partner, partner. That's where we're going.
Yes.
Excellent. I love it. Thank you so much, Elizabeth, for being here with us today. We so appreciate your insight, your knowledge, and your ability to kind of bring it to our level and say there's things on both aspects that we could be improving and strengthening for the outcomes of our students. So thank you so much for that.
Thank you, Dawn.
Thank you to all of you in the field. You truly inspire educational growth in your students every day. And a special thank you to John Ragsdale for producing this podcast. We'll see you next time on PaTTANpod.